I do complex stone disease, and often patients are treated with one of two modalities. One is shockwave lithotripsy or ureteroscopy, which is to go up to the kidney stone with a camera, break it up with a laser, or remove it one of two ways, either to grab it and remove it or to break it out. But there's a third modality that often is overlooked because a lot of urologists don't pursue treatment in this way, and mainly because it tends to be complex, but it often is the right way to treat large kidney stones, and that's called percutaneous nephrolithotomy, or PCNL. It's a way to treat stones that's considered minimally invasive. You can go look at very large stones in the kidney directly and break it up and suction them out. And patients often have one treatment or sometimes two treatments to clear almost a kidney full of stone versus doing 5, 6, even 10 treatments the other two ways. There's risks with all of these, including shockwave, including ureteroscopy and PCNL. However, when you keep having to go back to the operating room, the risks that go along with that are quite significant. And when you can have percutaneous nephrolithotomy to treat your stone, especially stones that are very large, you may just be going to the operating room once and have minimal risk of going to anesthesia over and over and over again. I actually do a lot of my cases now in supine position, meaning that you're on your back, something that every patient knows and every operating room knows, and often is safer from an anesthesia standpoint. My patients do, I think, better because of that alone. I also do mini PCNL. A lot of patients do ask about that. There are times where that's appropriate, and what that does is it minimizes some of the risks that may be associated with a traditional PCNL. My training in PCNL is actually through my residency. We were a very stone-heavy program. The University of Missouri, it was a tertiary care center which brought in patients from the entire state. So anything that was particularly complex would show up at our hospital. And so my training is special in that respect, in that I saw a whole host of large kidney stone burdens that often were not touched by other doctors out in the community. On top of that, I was at UC Irvine, where the pioneers for some of this stone surgery are. And it was a fellowship, it was a research fellowship, but being around them and learning from them is something that I think a lot of urologists don't get to experience, and so I bring that with me.